invocation followed by the Pledge of Allegiance.
Dear Lord, thank you so much for the opportunity to gather here this morning. Thank you for listening to us and hearing our concerns. I ask that you give this board the wisdom to make good decisions for the residents of the county. I ask you to be with our military and our law enforcement staff, to be with them during some hard times. Guide us, keep us in your care. We ask this in Jesus' name. Amen.
I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For the purposes of attendance, the clerk will call the roll.
Connor.
Here.
Geiger.
Here.
Gibson.
Here.
Jackson.
Here.
Parker.
Here.
Smelker.
Here.
Wing.
Here. Approval of written agenda. At this time, any commissioner or member of the public may ask for an item to be removed from the consent agenda and placed under items for consideration.
Move we approve.
Second.
Sorry about that. Any discussion, I guess? And then all those in favor, please say aye.
Aye.
Opposed, nay. Motion carries. Agenda is approved. Wow, it seems like it's been a long time since we had a meeting. Reports from state and county officers. Does any state or county officer or their representative have a report to share with the board? Sheriff Lee.
Not so much a report. This Sunday from 1 until 3 at the Elks, Sue Delcato. She was one of our deputies. In fact, the first female we've ever sworn in as a deputy. Anyway, she died last Wednesday, and her memorial service will be held up at the Elks Club. It's actually a celebration of life, is what they're calling it.
When is that again?
This coming Sunday, the 5th, from 1 until 3 at the Elks Club. Got it. Michael?
Yep.
Okay, all right.
Thank you. I'm sorry. Yep.
And it's an open invitation. You want to come and show your respects and hear some funny stories about Sue. I'm sure it'll be a good time. Thank you.
Any other county officers? Thank you. At this time, any member of the public wishing to address the board may do so for up to limited public comment, sorry. May do so for up to 3 minutes.
Morning.
Morning, Jan.
I wanted to update the board on our request for the youth center and the software that's on the agenda for today. So our grant through the Continuum of Care has approved the full $3,500 to be reimbursed through the grant, plus the first full year. So I just wanted to make the board aware of that. Thank you.
Thanks. Is there any other public comment? Various correspondence. Does any commissioner have any correspondence to share with the board? Seeing none. Consent items.
Madam Chair, I move for approval of item A, approval of February 12, 2019 Board of Commissioners meeting minutes. Item B, approval of February the 19th, 2019 Committee of the Whole meeting minutes. Item C, approval of the agreement for economic development services between Berry County and the Berry County Economic Development Alliance and its parent organization, the Berry County Chamber of Commerce, for the period January the 1st, 2019 through December the 31st, 2019. Item D, approval of the purchase of the Youth Center Juvenile Case Management Software. Item E, approval of the grant for $10,000 between Michigan Department of Health and Human Service and the Trial Court for Regional Detention Support Services, and authorize the board chair to sign the contract.
Support.
It's been moved by Gibson, supported by Parker, to approve the items listed under the consent agenda. Discussion is not allowed and a roll call vote is required. The clerk will call the roll.
Connor.
Yes.
Geiger.
Yes.
Gibson.
Yes.
Jackson.
Yes.
Parker.
Yes.
Smelker.
Yes.
Wing.
Yes. The consent agenda is approved. Presentations. We have Liz Lenz, Coordinator of the Berry County Substance Abuse Task Force. Morning, Liz.
Is my presentation going to come up there?
Yes.
Oh, good. Good morning. Thank you for letting me come to speak with you this morning. I'd like to come talk with you all every couple years or so to give you an update on kind of the status of Berry County as it pertains to substance use and the issues that we experience for that. Thank you for your service. I'm glad we have a full room today. So I'm old, and there used to be a commercial on TV for some shampoo called Fabergé Organics, and it said, "You tell two friends, and they'll tell two friends," and so on and so on. And many of you have already heard me say that, but that's how I do my work. I talk to you, and you hopefully go out and you talk to more folks, and you share the information that you have. So up on the screen, you see the 2019 overview. I've prepared some packets for you, and in that packet, there are some materials about some things that we have going. So I'll just, as I see some people kind of going through the packet, I'll explain what's in there. So, Hoot, if you don't mind being my Vanna White, would you hold up what you've got in your hand, and I'll explain what that is? So, this is. I thought it was a good comparison. So first of all, the Substance Abuse Task Force is heavily involved in the Suicide Awareness Initiative, which is part of the Berry Community Resource Network. It's one of the work groups. And we, even though you might not think they're connected, or maybe you're aware that they're connected, they are. Substance use and mental health do go hand in hand, unfortunately. So in there you see the flyer to help. It says HOPE on it, and that's something that we distribute widely. We have just added a 5th law enforcement permanent medicine collection at Berry Township. Maybe you can hold that one up, Hoot. So this is our new flyer, hot off the press. Berry Township Police Department actually has a law enforcement medicine collection box, and they can accept all substances, prescription medication, over-the-counter, and even controlled substances. So that's good news there. And then Hoot has the Talk Sooner flyer. That's a campaign that we use with parents and caregivers to understand some of the risks that are out there facing our youth and how to talk to them about it. And if you'd hold up the blue postcard. See, the blue postcard, yep, there we go. You are doing great. So underage drinking, we have a lot of focus. The Substance Abuse Task Force does not do any one thing. We do a lot. And so the issue of underage drinking, although it is declining in Berry County, which is good news, it's still our #1 substance issue for our youth and our adults in Berry County. And that usually surprises people because they tend to think of maybe the ones that we hear more about. If you'd hold that one up, the one with the orange on it, yep. So you may have heard that there's an opioid epidemic happening regionally, statewide, nationally, and right here in Berry County as well. We are not untouched by that. So this is some information about how to seek help. And I'd like to say that this flyer came in response to something that Commissioner Geiger asked for about a year or so ago. He said, boy, we're just really getting a call for some information on how people can access help. And then lastly, you'll see that there is kind of an annual report of where our youth data is. Every 2 years, there is a youth survey that is administered to 7th, 9th, and 11th graders throughout the county. And this is kind of the good and the not so good of where our data sits. And so some of that will be in your overview today. So who's holding up the last piece, I think, and that is simply we've been asked by some community stakeholders and community members to kind of put together some talking points about marijuana and some of the science, some of the research that's out there, and how this may impact our community. And that simply is what we have for you. My staff very carefully put that together. They've cited their sources and given kind of a thoughtful viewpoint of what some other states have experienced, because quite honestly, we just don't know what's going to happen in Michigan. And I'll be right there with you figuring it out. So if I may go ahead and start the overview. Thank you, Commissioner Gibson. I appreciate you playing along with me today. So let's give him a round of applause there.
Yahoo!
I didn't win any money though, but okay. So you know the Substance Abuse Task Force has been around for 15 years. We started off as a meth task force, and in 2007, we finally were able to bridge that gap and help people understand that while meth was an issue, alcohol and other substances are equally as damaging and problematic, and we became the Substance Abuse Task Force in 2007. In 2009, 2012, 2014, and 2018, the Substance Abuse Task Force was recipients of federal grants. Some of those have been the Drug Free Community Grant, the Sober Truth on Underage Drinking Prevention Grant, and most recently in 2018, we were recipients of the Community Local Response to Opioids Grant. So that's good news. That's really good news. When we can receive federal funding to address our issues, we will do so, and we will do so collaboratively. Our motto is that we work together and that we're working together for a drug-free community. So if you go to the next slide, you'll notice that, again, that annual report is there, kind of the MiFi data at a glance. If any of the commissioners would like to see the MiFi data that we take a look at, which is mostly substance use and mental health in nature, I do have a couple copies of that. I'd be happy to share that. So if we go to take a look at the next slide, it says emerging drug trends. What are we concerned about? What does our data tell us? We'd be nothing without data. So we collect data from lots of places, from anecdotal data, qualitative data, quantitative data, youth data, treatment admission data. You name it, we'll collect it if it's meaningful. Not all data is as meaningful as we want it to be. So we kind of have to look at data and see what it's telling us, and if it's telling us something we need to respond to. So right now what we know is out there are some changing attitudes and norms relative to marijuana. Some of you may know one of the Substance Abuse Task Force members. His name is Steve Hoke. And he looked at me probably 3 or 4 months ago and he said, Liz, we're just going to have to think about this differently. We have to come about this differently. This is different times, different messaging. We really have a challenge to help people understand what some of the concerns or the issues around marijuana are now that it is recreationally legal. So again, the legalization of marijuana, recreational use is an issue. The opioid and heroin epidemic, drug overdoses, and providing access to Narcan. E-cigarettes and vaping are of a huge concern. And unfortunately, the methamphetamine problem has not gone away, and it has morphed into something different from what we saw in 2004, 5, 6, and 7, and even most recently in 12 and 13, 14, when one pot method was was the trend. We now are seeing different trends, including ice and crystal meth being brought in and purchased. So if we take a look at the next slide, we always are taking action. We are an action-based task force. Once one of our work groups has accomplished its task, if they don't have another task to take care of, they will disband or take a hiatus and then come together when it's needed. So we are very action-focused, and I've given you kind of a list of some of the things that we do. I know you can read it, but we do needs assessment, data collection. We recently have formed the marijuana work group to take a look at some of these issues, and I'm getting old, so I have to put my glasses on. I mentioned about some of the grants that we've received. Berry County should be very proud because not only do all their law enforcement entities and most of their fire departments carry Narcan, but some of the first responders also do. So we are very well trained and well equipped with Narcan kits out in the field. So this is one of these issues that can be polarizing, right? Some people say we shouldn't be giving access to Narcan. We shouldn't be giving it to them. Sometimes I see things on social media that hurt my heart, right? I'll own this. So we see sometimes that if an EpiPen isn't free, why should Narcan be free? Well, it's not free, folks. It costs somebody some money. And people have written grants to provide access in the SWMBA region, which I know some of you are familiar with. The Southwest Michigan Behavioral Health is our regional entity. And they wrote some grants to provide access to Narcan kits for our first responders, our firefighters. and our police officers. In addition, we can do community overdose prevention trainings, and I think there's a flyer. I brought some extra. We do have a training coming up March 26th where we can provide community members with the training, and they can walk away with a free kit if they wish. This can save a life, and it has saved lives in Berry County. Our law enforcement had 4 reversals in the 2 weeks in between Christmas and New Year. So, in addition, you can kind of see some of our other things. We always have media campaigns going. We try to get people where they're at. So you'll see us out and about in the community, ourselves or our members. We like to go to the fresh food initiatives, and we hand out newsletters to try to promote events that people may not be aware of, because we're finding that in this world of social media, everybody's connected, but nobody really is connected. So we're trying to get back to that one-on-one connection about information. So the next slide that you see, I share this because, as I mentioned, we're part of the Southwest Michigan Behavioral Health regional entity, and people are often surprised to find out that in terms of treatment admissions for either Medicaid or state-subsidized treatment, which we can track, we can't track private insurance, we can't track self-pay, but we can track those folks that come to us as a primary substance at time of admission, and we know that alcohol is the green on the far left, and that is always our number one substance for which people seek help. You'll notice that the purple is that trend where we're seeing an increase in requests for treatment for meth or ice or crystal meth again. And the good news is that we've seen a bit of a decrease in treatment admissions for heroin and opiates, which is good, but data can tell some other stories too. And we see that is reflected in that meth or that ice number. There is some thought that as those access to heroin and opiates decrease, seeking methamphetamine or ice or crystal might increase. So we're kind of watching some national trends on that. And when I come give my next update, we'll know where it's going. So just a glimpse and just a reminder, if we go to the next slide, that everything we do is multifaceted. We don't tend to operate in a vacuum or a silo. We tend to partner with everybody and anywhere and work together, try to find common ground so that we can make a difference in this community that we all care so deeply about, right? So just give you a look at some of the media campaigns that have been out there. For posterity's sake, I'd love it if you all raised your hand and you said you saw them. But these are some of the messages that we've been sharing with the community in a multiple of ways. And you can see that we aren't focusing on any one substance, but we focus on what our data tells us we need to focus on. And then I'll wrap up here before I take questions with the next slide. 5 things I'd like you to take away with you today is that in 2018, our youth data showed us the lowest number ever of past 30-day use of alcohol amongst our high school students. Actually came in at 16.7%, and that is the lowest we've ever seen. That follows a national and a statewide trend. And the bad news is, if you will, that if you look at the 3rd and the 5th, we are seeing a huge increase in the past 30-day youth use of vaping or e-cigarette use. And unfortunately, we're seeing a very low perception of harm of marijuana amongst our youth. And no matter how we feel about it, I think we can all find that common ground that we really want our youth to have a development and a growing time where they're free of the influence of any mind-altering substances. So we know that as the perception of harm decreases, the youth use will increase, and we did see an increase in youth use of marijuana in 2018. So if I go back up to the 43%, we're making some strides on decreasing youth exposure to secondhand smoke. That will continue to always be an issue, and we have no idea right now, I'm going to be real honest, we have no idea about exposure to vaping secondhand. We don't know. We know that there's chemicals in that vape, but we have yet to see the science, so we're always looking for it. And then I did mention about our medicine collection, so we work together to provide more access to that. So do you have any questions for me?
very nice.
Thank you.
I mean, your presentation was very nice.
I hope it was helpful. I'm always willing to come sooner than 2 years. If you want me to come back sooner, just reach out. If I need to, I'll reach out. I appreciate that you have listened to me, and thank you for helping us all work together. So thank you.
Thank you, Liz.
Thanks,
Thank
Liz.
you.
Before we move on to public hearings, I'd like to take a 5-minute break.
Okay.
Is there any objection?
No.
Great.
Victor?
I only want 5.